Hi, my name is Callie Hatch, and I am doing my video for the lab for assessment of the head, neck, skin, hair, and nails. Excuse me, I'm sick. I apologize. This is my husband Jay. He will be my assistant today. So first I'd come in and do hand hygiene. I'd pull a curtain or make sure there's privacy. I'd introduce myself to the patient. I was like, hi, my name's Callie. I'm going to be your nurse for today. I'm also going to explain to them that we are going to be doing a head-to-toe assessment of what's going on. I would confirm the patient, name, date of birth, make sure they understood what we were doing today and they were comfortable. Once I determined if they're comfortable, I would go ahead and start at the top of the head. First, I'm going to look into the hairline. The hairline is actually important. We're seeing a lot of hair loss right now with the GLP-1s, gastric bypass patients, things of that nature. We may also see that there are marks on the back of the head where people have been immobile, like bedridden, and may not notice it. Another factor that I do want to point out that people don't think about is that people in their cars sit and get sun exposure. So there's oftentimes cancer lesions that they don't recognize because it's in the hairline or behind the ear, and they just don't happen to see it. I'm also going to be looking for things such as lice, flakiness, dryness, things of that nature, just to see their health. You'll also see if they're disheveled as you walked in. So being disheveled may mean that there's a mental health issue as well. At this time, I'm going to test the temporal arteries. I'm going to feel for strength, and I'm going to make sure they're even. I'm also going to check the sinuses while I'm here. I'm going to check the eyes for perla. I'm also going to check for stegmus and make sure they're not cross-eyed or there's any issues with that. I'm going to check for perla, of course, and I would use a light for that to check for dilation and equalness. You're also going to look at the eyes for any redness, jaundice. Jaundice is a big one. It's going to tell you about possible disease, liver problems, hepatitis, things of that nature. Red could mean conjunctivitis, but even rubella is showing conjunctivitis right now in its symptoms. So that's important to see right now. I'd also check the ears, look for excessive drainage, look for, like I said, any lesions behind the ear as well. At this time, I could also have them move their jaw, make sure there's no clicking or pain there. I could also have them raise their eyes up and down, close, squint up for me. You can also have them stick out their tongue and go side to side and make sure there's no deviation there. You check teeth. You can check teeth at this time as well. Any thrush on the tongue, things of those natures. All right, then I'm going to go to my carotid. First, I'm going to visualize for any JVD. So you can look at that and see if there's any, the vein is, or I'm sorry, the artery is sticking out at all. You can also look if there's any pulsating there. You're going to feel both sides. This is a really good one to do during CPR because it's a good strong pulse. So a lot of times we'll check there during CPR. You can also auscultate. You're going to look for any deviations of the trachea. This could show if there is like a compressed lung or something like that. If there's a deviation, there's a lung problem. So they may need a chest tube or something like that to alleviate pressure on one side. Then I'm also going to look at the skin area of the neck because, again, that's also commonly exposed to sun. I'm going to go ahead and come down. The brachial artery here is often used with children because it's a good one to, with infants, sorry. It's a good one to check. I'm going to look at the skin. If there's a lot of skin tears or bruising, it may be due to blood thinners, or skin tears may mean they're falling down a lot, which may indicate a medical condition or intervention that needs to be done. I'm also going to test for dehydration by seeing if it's tense. I'm also going to look for edema. So if there's any edema in the arms, it may be retaining fluid. I'm going to test the radial. I do them both at the same time to make sure they're even. If they're not even, it could mean a heart condition or a heart problem. So that's very important. You're going to look at if they're 2+, 3+, 4+, or not at all. If they're 0 or 1, you have a circulation issue. I'm going to test for warmth. I'm also going to test the cap refill. I'm going to look if the nails are healthy. Again, if they're having malnutrition, they may have brittle, cracked nails. Ridges may mean trauma or another condition. If they're clubbed, it may mean they're having issues getting oxygen or cyanotic often. I also do grips at this time, so I usually have them do grips, make sure their strength's good. I'm going to look at the skin and also too, especially on the back and the buttocks if they're immobile, because they can get bed sores there often. The femoral artery in the inner groin is often used during CPR because there's so much going on here with if there's CPR being taking place or there's a tube in their mouth. Sometimes that real strong femoral is where we test. We also need to know if it's good in case we need a central line. Then you're also going to check the legs and whatnot for the same things as you're looking at the arms. You're going to look for any excessive bruising, any scars, any type of skin tears, things of that nature, again, for possible intervention, or if there's excessive bleeding. Edema is big in the legs, so check the legs for edema, okay? As I go down the legs, I'm going to, not as commonly used, but you can test the popliteal artery here behind the knee. And then, if I can kind of turn this, sorry. I oftentimes, especially with my diabetic patients or patients with circulatory issues, will test the posterior tibial artery, which is right inside the ankle here, around right behind that protruding area of the ankle, and then also on the tops here. Again, you're going to see if they're even. If you've really poor pulses, they're not as strong down here usually, but if they're really weak or you cannot palpate them, you may need a Doppler, and that may mean that there's circulatory issues. So oftentimes too, if you find them, mark them. They are harder to find, so we'll take a little marker and mark them. But testing that for especially our diabetic patients or patients with circulatory issues is really important, because if they have poor circulation, they can get wounds to the feet, and then oftentimes leads to amputation because they don't heal as well. Again, cap refill is going to be tested here to make sure that it is good in less than 2 seconds. You can look at the nails as well. You can look for any lesions, sores, or anything like that. And that's my presentation. Thank you.